Dermatology's really been changing a lot recently. I think there's a lot more attention on preventing signs of aging.
That's the power of dermatology, right? So it's about preserving your skin health, making sure that the skin really is doing its best job. What do you think about the world of dermatology today? I know that's a super broad question.
Prejuvenation is the preventative approach to anti-aging. So we can talk about more corrective treatments that patients might seek down the road when they have discolored skin from sun damage, broken blood vessels, brown spots, uneven skin tone. And then we can talk about the preventative treatments.
I think simple preventative strategies are really helpful when it comes to not only your skin health, but of course your overall health, right? If you had to tell someone about what not to do, what would you say? I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. Hi, I'm so excited to have Dr. Brian Hibler here on the Give Good Face podcast. I've known Brian for quite some time now. He is an amazing dermatologist focusing on aesthetic dermatology as well as laser medicine. Brian is a board-certified dermatologist. He did his residency at Weill Cornell Medical College, and he did a fellowship in aesthetic medicine, aesthetic dermatology, and laser surgery at the Harvard Medical School and the Wellman Center for Photobiology. Mm-hmm. So welcome, Brian. I'm so happy that you were able to come on.
Thank you. I'm so excited to be here. I can't believe we've known each other for 10 years now.
I know, but we still look the same.
Or even better, hopefully.
Well, that's the power of dermatology, right? I think we know in this field that we can really help transform someone's skin, whether they do have a skin problem, a skin issue, or if they're just looking to improve their skin overall, improve the health of their skin. And I really like what you do because your practice is pretty unique and you're really focusing on what we call prejuvenation. Mm-hmm. So give me a little idea what that's about. I know what rejuvenation is. The audience has heard of rejuvenation. The audience has probably heard of anti-aging, even though I don't love that term because I think we should just be pro-aging.
Yeah. No, I think that's a really good point. So prejuvenation is this concept. It's a preventative approach to anti-aging. So it's putting more of an emphasis on prevention rather than correction. And so down the road, when someone's a little more mature, older, they've had a lot of sun exposure, they're going to need a corrective treatment to try to repair the skin, to get rid of the uneven skin tone, the brown spots, the broken blood vessels, the lines and wrinkles. But now we're shifting our focus, and younger individuals are thinking about this at an earlier age. They don't want to get to that point. They want to prevent those signs of aging before they appear. And so there's a few things that we can do by having a really good skincare routine, something you can do every day at home. And then there's also some stuff that we can do in the office in terms of minimally invasive cosmetic procedures and lasers to not only make the skin look more youthful, but behave in a more youthful fashion.
No, I love that. I think, the best offense is a good defense, right? So being proactive and preventative is really important and helpful. And I think a lot of people want to know how to do that or how to even start or go about that. So you have someone who is younger. When is young too young?
Yeah, so this is really popular on social media right now. We see everybody's talking about their skincare routine, and I get asked this a lot. At what age is it too early to be thinking about this? When it comes to prejuvenation, it's a multifaceted approach. We have a good topical skincare routine, something you can do at home, and then we have in-office procedures, whether that's injectable treatments or lasers and things to help prevent signs of aging. And so when you're young and when you're in your teenage years and early 20s, I think the most important thing is being aware of how much sunlight you're getting, how much UV exposure. So I don't want you to go out and tan and seek that tan because we know that that's going to lead to signs of aging down the road. Using a daily sunscreen, really simple things. You don't need to overly complicate it. But as you get a little bit older, you might want to start to incorporate a topical antioxidant in your routine, focus more on the skin barrier and keeping good hydration of the skin and trying to avoid things that might irritate or cause inflammation in the skin because we know that these types of things can lead to signs of aging. When you get into the later 20s, maybe in your 30s, that's when you might start noticing some fine lines, wrinkles, brown spots that are starting to appear, broken blood vessels. And that's the point at which you might want to start to consider some of these laser treatments and other things that we can offer just to help keeping that skin look youthful. But it's really on an individualized basis. It's going to come down to someone's skin type. Are they kind of more fair-skinned or darker complexion? How much sun exposure have they had? What's their genetic makeup? So it really is sort of on an individualized basis.
No, I love that. I think simple preventative strategies are really helpful when it comes to not only your skin health, but of course your overall health, right? Exercise, diet, all these things that we can do on a regular daily basis and be mindful of can really help us set a really bright future. So, I know there was a good study from Asia using IPL, which is not even a true laser, but just multiple wavelengths of light. They did an IPL at regular intervals, and that's all the patients did and they followed them for quite some time. And they just showed that regular intervals of IPL, just to help with the dyschromias or the discolorations in our skin, the broken blood vessels, they looked markedly younger. And we could say the word younger in that they appeared younger, right? Their age wasn't any different. They actually got older in chronological age, but their skin appeared healthier, down the road when they finished the study. So I think that's pretty powerful.
Right. I'm a big fan of those types of treatments. So IPL or intense pulse light, you can use different filters to use different wavelengths and target different structures in the skin. So if we want to try to reduce redness and broken blood vessels, we can target the hemoglobin in the skin. If we want to try to reduce brown spots, freckling, uneven skin tone, we can target the melanin in the skin. And so that's a very safe, very gentle procedure with little to no downtime. And when it's performed at routine intervals, you just keep that skin looking nice even skin tone, even complexion. And so that's something for patients who are concerned. They don't want to change the look of their face. They're concerned about injectable treatments or something. If you just do some laser treatments to help get more even skin tone and complexion, it's going to make you look a little more healthy, well-rested, refreshed, and like you said, even younger, even though you're aging.
Yeah, no, I love that. I always caveat, people shouldn't be doing IPL or any laser treatments when they're tan, right? If your baseline is more tan at this point, you should not be doing any laser treatments, right? Because that melanin that's sort of activated, that's giving you that tan, is going to react quite strongly to the wavelength of light that they're using. So always word to the wise. I just, want to put out good messages.
Yeah, I think that's very important. I think you need to see someone who has appropriate training in doing these procedures, that they can screen you out and make sure you're a good candidate for these treatments, because there are real risks associated with these laser treatments.
And you and I have both seen quite some adverse events when people even did laser hair removal when they were tan, because that wavelength of energy is picking up not only the hair follicle that's dark, but also that background melanin that's causing the tan. So, they're competing and you can get burned very easily.
Right. Yeah.
Yeah. So good start. So, okay, someone comes into your office and they want to do everything. What would you start out with let's say for a millennial, right?
So that's kind of my target demographic. I practice on Park Ave. I've got a lot of young, kind of mid-30s patients coming in. They might come see me for their skin check and general dermatology, and then they'll kind of ask a little bit. They're noticing uneven skin tone, uneven texture, and so when patients come in and they start to talk about cosmetic procedures and they've never done anything before, some of them are a little apprehensive. They see things on social media. They might see some misinformation out there. They might see some not the best work out there, and so they're worried about what these treatments might entail. So what we have to do is a lot of education. We have to teach them what can these treatments do, what they can't do. And my approach is to sort of give the patient all these options in terms of what can we do. So if we do a little bit of treatments like injectable neuromodulator, your Botox, that's going to help relax dynamic lines. So wrinkles on the forehead, between the eyes, around the eyes.
So is that baby Botox?
Well, yeah. It kind of depends upon the patient. If they're young and they don't have lines, but they have really strong muscles, they need an appropriate dose of the neurotoxin to adequately relax those muscles. If you underdose them and you do this baby Botox, it's just going to wear off more quickly. And we've seen that happen. There is a correlation between the dose and the duration.
Totally.
And that's been shown with a few of the different neuromodulators on the market. So if we're just talking about neuromodulators here, and someone's young, they don't have significant lines and wrinkles, we talk about all the benefits of a neuromodulator treatment. You can reshape the eyebrows. You can open the eyes, make them look a little more refreshed and well-rested. You can get rid of those 11 lines when they're always squinting to look at their computer screen or, furrowing their brow at someone. And then there's all these off-label ways that we can use neuromodulators to sort of contour the jawline or treat their TMJ. So we talk about all these different ways that we can use a neuromodulator. I think when they're young and we're talking about prevention of these lines, I tell them they don't need to do it every 3 months around the clock. I think
Agreed.
even if they're doing it once or twice a year, they are reducing the number of times and how hard they're crunching those muscles as compared to their imaginary identical twin who wasn't doing neuromodulator treatments. So they will slow down the formation of those lines. And there are some identical twin studies and case reports that have been published showing a difference between the two identical twins. In the twin who repeatedly did neuromodulator treatments and the one who didn't, you can see a difference in their lines at rest.
Yeah, I mean, those twin studies are amazing because they're basically showing the same genetic makeup, right? So genotypically, these people are the same. Phenotypically, they're pretty much the same. They're identical. However, they're different lifestyles, right? So one is getting neuromodulator or neurotoxin. We use those interchangeably. That's something like Botox, right? So if they're getting regular Botox, they're actually preventing the formation of these lines because they can't make that muscle movement. And I like what you said about baby Botox because that's so ingrained in sort of the social media world. Like just little sprinkles of dosage of Botox would help because it gives a more natural appearance. But I think you and I both know you can give someone a very natural aesthetic and a natural look without underdosing them. And also, we want to be really mindful because if people are starting younger, that gives them more time to, build up a tolerance to this, right? So Botox or any neuromodulator is like a drug, right? That it is a drug that our body can become accustomed to. So we don't want to overdo it, right? And we don't want to make frozen faces anymore.
Right. No, you're absolutely right. But even in a young individual, just because you're young doesn't mean you need baby Botox. There are a lot of young individuals, young men that have bulky, strong muscles up there. So you need an adequate dose to relax those lines. If you underdose, you will see improvement at 2 weeks, but it's just going to wear off more quickly. And I think that's not good. I think you don't want to then have to repeat those treatments so frequently. And it's just better for the patient to give them a nice response that's going to give them a good duration of treatment. And again, I tell them, don't worry about coming in every 3 months right around the clock. When they start to notice that those lines are becoming present at rest, then you may not want to have those periods of inadequate relaxation, and you might want to do the treatments a little bit more frequently or closer spaced together. But again, that's getting, when they're starting to get a little bit older.
Yeah. I think you and I share a very similar aesthetic when it comes to cosmetic work. We also share a similar aesthetic in suits, and which is great. But the one thing I really don't want to see anymore is these frozen faces that can't emote. They can't show emotion, especially for people who are on acting or on TV, like or any of those people that are coming to us. We really want them to be able to like share their expressions and share their feelings. We're still human, so we want to emote and have facial expression because that's really important. But I think what you talked about, the facial reshaping, is really cool. You and I both traveled to Korea, and we actually spent time with a dermatology group out there. And, seeing how they're reshaping faces was really interesting as well. And I think, we both learned a lot early on. I find it really fascinating. What do you think about that when someone comes in and says, I want to change the shape of my face?
Yeah, I think it's interesting because I find fewer patients coming in wanting for that right now. I think there's a lot of apprehension that they're going to completely change the look of their face with a single syringe of filler. And then we have to, tell them that's a fifth of a teaspoon and it's the volume of a blueberry. It's a very small amount. When it's strategically placed, you can get a really nice result. But right now in my practice, I'm not seeing a lot of patients that want to dramatically change their look. I get the younger patient population, even the Gen Z population, who's really into their individuality and their uniqueness, and they want to preserve that. And I really like that about sort of the state of aesthetics in that younger demographic. As I was sort of alluding to before, there's a few different buckets. And for me, it's your neuromodulators, your fillers, your laser treatments for the skin tone and complexion, and then your tissue tightening treatments. And that might be your ultrasound or radio frequency kind of treatments to build collagen. And when you mix and match and do a little from each of those buckets, I think you keep a very nice natural aesthetic. And it's just a good sort of a routine that you can get on and incorporate sort of each year doing a little bit from these buckets, and you're going to keep it very natural. So I'm not seeing as many patients coming in who want to do anything too dramatic to reshape their face every once in a while. And, then we've got some devices and modalities that we can do. But I kind of like how there's this emphasis on uniqueness and individuality right now.
Yeah, that's amazing because at one point it was all about the Instagram face, right?
Yes.
The Kardashian effect, the Instagram face, like this very homogenous look.
Everyone was morphing. They wanted those high cheekbones, the big lips, there were the big eyes, the cat eyes. Like everyone was starting to look sort of the same. And now I think we're kind of shifting a little bit away from that, which I really appreciate because I think there's so many other treatments we can do to focus on the health and quality of your skin and really just embrace our uniqueness. I think that's really important.
I know we're in the era of individuality again, which is amazing. I love looking at people's faces. I think, and New York City is probably the best place for that.
A lot of
people
faith,
watching, yeah. And just seeing all the different blends of cultures and ethnicities, it's really striking. And I always say that to my patients is like, you want to preserve your individuality. It's you're unique, right? Even if you have a identical twin, there's only two of you, So, but it's really cool to see that that's coming back now, which is awesome. Hey everyone, I want to take a quick break from today's episode to introduce you to a fantastic tool, Hygge Health Light Therapy. This light therapy device harnesses the power of red and near-infrared light to promote skin rejuvenation, reduce inflammation, and even help with collagen production. It's a safe, non-invasive way to brighten up your complexion, ease muscle tension, and improve your mood, all from the comfort of your home. I've seen remarkable benefits with light therapy, and Hygge Health makes it easy and accessible for everyone. So if you're serious about glowing from the inside out, Hygge is your go-to. Check out hyggehealth.com and use code GIVEGOODFACE for an exclusive discount. Glow brighter, live better with Hygge Health.
I want to touch on something you were talking about before, which was the neuromodulators. Again, Botox has been on label for cosmetic use for over 20 years now, so we have a lot of long-term experience with it, which is very reassuring for our patients. And like you were saying, patients don't want to be frozen. We don't want to give them that frozen look. And so my approach for the younger patient who might be a little apprehensive is to usually I'm a pretty good judge at an appropriate dosage for them by looking at them and having them animate, make an angry face and raise their eyebrows and stuff. But I'll give them a conservative treatment and bring them back in 2 weeks because that's when it should be fully kicked in. Mm-hmm. And then at that visit, if we need to add a little bit more, we will. And I keep track of that cumulative dosage so that way in the future I can start with that. And Botox and Dysport, Xeomin, all of these neuromodulators, I think it really, it's not so simple to it's not just algorithmic and point and shoot, because I see a lot of patients who come in that have had their Botox treatments elsewhere and they've got really arched eyebrows or they've got this abnormal wrinkling along the anterior hairline. And so I think it's really important that you properly assess that patient. And there's a lot of factors you have to take into consideration, like the brow position, the shape of the brow, and how can we utilize these to elevate that brow, open the eye, lift the tail of the brow. And so I love it because there's that art to it as well. And I learned a lot of that from you and with a lot of the other cosmetic dermatologists that I've trained with. And I think that's what can really set you apart, even with a treatment like Botox.
I know. I think it just underscores the importance again, that the patient, who is also a consumer, right? Because these aesthetic treatments are paid for, they're not covered. They really need to choose someone who's going to be with them for a long term, understand their face. Mm-hmm. I think it's a long-term relationship, that you want to make with your dermatologist because
Absolutely.
They'll understand you. So it's really important to get someone that understands you, understands the goal, and to not lead you astray, right?
Yeah, and that's something I sort of pride myself on when a patient comes in and maybe they seem a little overwhelmed when we talk about these buckets of treatments and all the different things that we can do. I kind of put myself in their shoes and I talk to them, what bothers them? What do they notice the most? Is it the texture? Is it the brown spots? Is it the lines and wrinkles? Then maybe I'll choose to start with a treatment that's addressing their primary concern. But then when they look to me and we talk about all these different buckets, I sort of think, where are they going to get that most value, the biggest bang for their buck? Because like you said, they're paying out of pocket for these treatments. And so sometimes it's a laser resurfacing treatment, and those results are going to last a long time. Sometimes it's a little bit of filler strategically placed to restore some volume loss. And so not only is it the art when you actually render the treatments, but it's kind of visualizing what is the impact that each of these treatments are going to have, and how do you strategically order them so that you give them the best results up front.
Yeah, you know, I'm a big fan of laser resurfacing. I probably do at least one fractional CO2 a year to myself,
Yeah.
right? Because I had a history of tanning. I used tanning beds when I was a kid, which was, you know, a confession. I'm willing, I know. I tanned in the sun. I had blistering sunburns. I had all the things that you shouldn't have, right?
Yeah.
I even had an early skin cancer
Mm.
that I had treated. So I know I have had a lot of UV damage and cumulative UV damage. So I'm trying to erase that. I think I've done a
I think
pretty
you're
good
doing a
job.
pretty good
Yeah.
job. Yeah.
But, you know, I'm a huge fan of fractional CO2 laser, fractional ablative laser, non-ablative lasers. And I mean, you were at the mecca of where those were all invented with Rox Anderson, who is a professor of dermatology at the Harvard Medical School. He started Wellman Center.
Mhm.
Brian, you were his fellow.
Yeah.
And when you were there, you two did a great study. And like, I love that study that you performed, because something we sort of knew already about the prevention of skin cancers with fractional ablative or non-ablative lasers. So just tell us a little bit about that study.
Yeah, it was a privilege to work at the Wellman Center for Photomedicine and work with Dr. Anderson and Dr. Avram. Those were my primary mentors for the year. And that's where they really developed a lot of the laser technology that we use in the clinics. Laser hair removal, the picosecond lasers, tattoo removal, fractional lasers that you were talking about. And when we talk about those resurfacing lasers, there's fractional ablative and non-ablative. The ablative lasers are a little bit more aggressive. They actually drill little holes into the skin or vaporize the tissue.
My favorite.
Those are pretty good treatments.
Yeah.
But then you've got the fractional non-ablative lasers, and those put heat channels down into the skin. So it's not vaporizing the tissue, but it's putting heat channels down into the skin to build new collagen, to get the skin to sort of peel, exfoliate, and remove signs of sun damage. And we often use these lasers for acne scars, lines, wrinkles, pores, uneven skin texture and tone. And what we've known for a while now is that the fractional ablative lasers, the ones that are a little bit more aggressive, can, by getting that skin to exfoliate, you can get a new, fresh, more youthful layer of skin there. And we've seen that this can have a preventative effect on future risk of skin cancer. But the ablative lasers are a little bit more aggressive, and they've got more downtime. They're a little riskier in terms of the wound care, the aftercare. Now, the non-ablative lasers, the one that put the heat channels down, those are routinely used for acne scars and brown spots and sun damage. So they don't have as much downtime. And what we did is we went back and looked at patients who were treated with the non-ablative laser over the course of a 7-year follow-up of these patients. And we looked at those who had a history of a facial skin cancer, and we compared it against a cohort of individuals who had a facial skin cancer and never underwent this laser treatment. And with a median of 7 years of follow-up, what we found was that the patients who had even one Fraxel, that's the brand of laser we studied, but one non-ablative laser treatment, they had almost a 50% reduction in future facial skin cancers.
And that was the 1550 nanometer and
Well,
then 1927?
We kind of lumped them together
Okay.
because we only had about 50 patients in the study, and so we didn't have enough to sort of split it out. And some had this 1550 nanometer wavelength, which goes deeper. Some had the 1927, which is more superficial. What's interesting is the 1927 nanometer wavelength is actually FDA approved to treat actinic keratoses or precancerous growths on the skin.
Mm-hmm.
In our study, the 1550 wavelength seemed to impart more protection on your future risk of skin cancer. So that one goes a little bit deeper. However, because the sample size wasn't big enough, we weren't able to do sort of a subgroup analysis between those two. But this was really the first study with long-term follow-up to show a statistically significant risk reduction in future risk of facial skin cancer. And when we say that, we're talking about non-melanoma skin cancer. So that's basal cell and squamous cell, which are by far the most common forms of skin cancer, over 5 million a year in the United States. So this gets me very excited. This is my most used laser in my practice. This is what I like to do for myself once a year. And this was really a nice study to show that these treatments that we routinely do for cosmetics, for fine lines, wrinkles, and sun damage, also impart a health benefit to the skin, that it may reduce your risk of future skin cancer. So I'm excited to see where this field goes, and as we obtain more data on this, I think it's really exciting.
Yeah, mechanistically, it makes sense, right? Because we're not only imparting heat into the dermis as well as the epidermis, but you're probably waking up some senescent cells, or these are cells that have sort of went into dormant mode, right? And
Mhm.
they're not doing much, but we can sort of wake them up, and that's the theory, right?
Yes, I think that's a big part of it. We don't fully understand all the mechanisms at play. We are doing a study right now where we did these laser treatments on the backs of individuals, and we took biopsies so we can better study the bio kind of chemical mechanisms at play to try to piece this story together. What you said is absolutely right. You're waking up those senescent cells, and also when we're doing these laser treatments and we're sort of shaving off those outer layers of skin, or we're putting those heat channels down, we're repopulating the skin cells from the stem cells that are located down in the hair follicles. And that's sort of a privileged site. That is deeper than what the ultraviolet radiation wavelengths typically reach in the skin. So these are sort of native stem cells that have not been exposed to UV damage. So we're getting rid of those outer layers that have acquired all of that UV damage over time, those precancerous skin changes. Those are all peeling, exfoliating off, and then our skin cells are repopulating from that healthy stem cell population. So we think that that's also another key player for imparting this protective effect.
Yeah, I love that. I think it's so cool. I mean, we're also not only just killing atypical cells that live on the top layers of the skin, but we're trying to wake up these, you know, stem cells that reside a bit deeper and get us to get new skin.
Yeah,
You know,
I think it's great because you get a beautiful cosmetic result. We use this every single day in my clinic for sun damage, for brown spots, freckles, lines, wrinkles. So not only are you looking a little bit better and more refreshed, but that skin is actually behaving in a healthier fashion. And so I would strongly recommend it for anyone who can take about a week of looking like they got a sunburn and getting a little bit of peeling and stuff. It does require a little bit of downtime, but the fact that it has both really significant cosmetic and medical benefit is a home run in my mind when it comes to cosmetic treatments.
yeah, such a great paper, and to you for studying that. I think it's interesting that we're at this era where yes, we're aging, but we don't have to age as quickly as we would have because of all these interventions. One thing that I think is really important to understand is, everyone is a little bit different when it comes to terms of how they metabolize, these products, or how they sort of, adapt to the environmental, aggressors that are happening, right? Obviously, genetics plays a big role, but lifestyle also plays a big role. If you had to tell someone a piece of advice about what not to do, what would you say?
Well, I think when we're strictly speaking about the skin, we can't ignore sort of the harmful effects of the ultraviolet radiation. But I don't want everyone to be vampires and afraid of the sun. I think it's more important that we live healthy lifestyles, that we're outside exercising and that we're socializing with one another and we're not afraid to go to the beach. But I think you have to pick and choose your battles. And that's how I sort of frame it for my patients, is that when I'm walking everywhere in New York City, I almost always have a hat on when I'm outside, and I try to make sure that I'm not facing and walking directly into the sun, or just I'll walk on the opposite side, the shaded side of the street. And I think those little changes every single day actually will amount to saving yourself from quite a bit of ultraviolet radiation. Same thing when I'm at the beach. I try to avoid going during the peak hours of the ultraviolet exposure, between 10 and 2. If I'm at the beach, I'm almost always found under an umbrella and probably under a towel under the umbrella as well. But, I think it's important that we're not sort of deathly afraid of the sun, but we're just being very smart about it. Because I've got so many patients that play tennis and exercise, and I tell them, look, I do all those things too. I just try to be very, very smart about it. And I think when it comes to your skin and the health of your skin, there's no denying that that's sort of one of the biggest factors for not only the cosmetic appearance of the skin and pro-aging and aging in a healthy fashion, but also reducing your risk of skin cancer.
That's good advice. Really good advice. I mean, I love going to the beach. I love playing sport outside. So I'm a big fan of just mineral sunblock every morning. Get into the habit, whether it's cloudy or not, because UV UVA passes through clouds, it passes through window glass. So it's really important just to get into good, like you said, routine, healthy habits.
Yeah, and I have to remind a lot of my patients, they work on Park Ave in these gigantic glass skyscrapers. So I tell them, when you're sitting at your desk, even if you're, if you're by that window, you might be getting a lot more UV exposure than you expect through that glass on one side of the face or the other. So there's all these little things that if you're just sort of aware of throughout the day, it might afford you a little extra sun time in other scenarios, other situations.
Yeah, I see what you're saying. So tell me about when is it too much? Do you ever have to turn people away?
With the cosmetic treatments?
Yeah.
Yeah, that's difficult. Thankfully, a lot of my younger patients are kind of naive to cosmetic treatments, so they'll come to see me first, and I really like that because I can sort of set them up for success and really emphasize how I keep it very natural through kind of mixing and matching those treatments. But I've got a lot of patients who spend some of their time in other cities like LA and Miami that are a little more known for
shots
their
fired.
cosmetic work. And it's difficult because you want to give the patient sort of their desired aesthetic and look. I can't be a judge of that. However, if someone comes in and let's say that they're asking for more Botox, but they don't really have any movement, or asking for more filler, but, I ask them kind of where they want it, and they're pointing to places where they might be a little overfilled. I think that's a really nice opportunity to talk about some of these other cosmetic treatments that we do, like the tissue tightening treatments or the laser resurfacing treatments. And that's a really good opportunity to educate them about all of these studies that we have about these treatments not only making you look more youthful, but also having healthier skin in general. And then I sort of try to finesse it and get them into my approach by mixing and matching these treatments and sort of spacing them out. Thankfully, it's not often that it happens, but every once in a while it is. And you just got to have a frank conversation with the patients and make sure that our goals are sort of aligned and that our aesthetics are aligned. But, there are times where I have to tell patients I don't know that I'm going to be able to offer them exactly what they're looking for.
Yeah, I think honesty goes a long way. We have to be honest with, our patients, how they're doing and ask them why they're doing these, right? A lot of people come to us in varying stages of their life. Mm-hmm. So it's important to understand, where they're coming from. Tell me about the tissue tightening procedures. I think that's sort of the next frontier, right? Like non-invasive tissue tightening.
Yeah, a number of these have been on the market for a while now, both ultrasound and radio frequency treatments. But I feel like they're experiencing a little bit of a resurgence with these, the new GLP-1 medications for weight loss. A lot of patients are coming in and they're noticing that with this volume loss, that their skin's got more laxity, that it's a little loose. And then we also have the patients who are maybe apprehensive about doing more filler, and they just want things lifted and a little tighter in a non-invasive fashion. And so what's really nice is that we have a few devices on the market now that work by heating up the deeper layers of the skin. So anywhere between sort of 1.5 and 4 millimeters deep in the dermis to build new collagen. And that new collagen that's the scaffolding of our skin. So when we build new collagen, it lifts the skin, it pulls the skin a little bit tighter. You got to be very selective on picking the right patient because these treatments, they're best performed in someone with kind of mild to moderate laxity, not someone who's more of a facelift or neck lift candidate. But these treatments really pair beautifully with everything else that I mentioned. And I think we're going to see them having a very nice preventative effect, that when we start these treatments earlier, kind of like we've seen and learned with the neuromodulators and fillers, that these treatments can also induce long-term changes, that when we start these tissue tightening treatments a little bit earlier, we will prevent individuals from developing significant laxity over time, or at least delay it.
Yeah. I always tell people to look at if they know their biological parents, to look at their parents, because most likely, barring any major lifestyle choices like smoking, drinking, excessive UV exposure, they will age structurally like their parents. So if you're noticing laxity in your parents, it's probably a good time to start,
it's good to be aware of
tissue tightening treatments, because it's really interesting. It's basically really using ultrasound, which penetrates deeper, right? We know ultrasounds because people get them during pregnancy. You can see the fetus. But these are micro-focused ultrasounds that are targeting the dermal layer. Do you think they're targeting deeper as well in some respects?
Well, they've got studies on these looking at sort of how deep the coagulation or sort of that heating effect is when they actually take a biopsy of the skin from participants during the clinical trials. And so with one of the devices that I use most frequently, the energy is really targeted at 1.5 millimeters deep, but we see that thermal coagulation zone between 1 and 2 millimeters.
Okay.
And so there is sort of a range of tissue that's being treated. And that's, I think, beneficial. It's sort of about that breadth of tissue that's being exposed to this very controlled, very safe ultrasound energy to build new collagen over this whole area underneath the surface of the skin that will impart the greatest lifting and tightening effect. And what's really nice about all of these treatments, the radiofrequency and the ultrasound, is that there's no downtime with them.
Yeah.
So they're a little...
So like the ablative lasers.
Exactly. Lasers, I always have to kind of remind patients, the lasers are going through the skin. And so you're going to have redness and swelling. You're also going to see more improvements in the top layers of the skin, but it's going to have that downtime. If someone really just wants a lifting and tightening effect, then these ultrasound and radiofrequency treatments just target the deep layers. So the surface of the skin is cooled and protected, so there shouldn't be any downtime. Maybe slight redness after the treatment, maybe a little puffiness, but that's it. So these are treatments that patients could even do during the lunch hour and go right back to work. Or if they've got a busy social and work calendar and they can't have any downtime, but they want something that's going to give a little bit of lifting and tissue tightening, these are a great option.
One thing I always have to remind, and I always like to be, candid and honest, is that these are not immediate result procedures, right? These are long-term gains. You're investing in the future, basically.
Right.
Because we don't see the collagen remodeling right away, right?
We know that process takes about 3 months. And so you're inducing a controlled wound with the use of this ultrasound or radiofrequency generating heat in that tissue. And then there's a few different waves in that sort of that wound response. So your fibroblasts will increase their collagen production. And then your body needs to convert that from sort of a temporary form of collagen to a more permanent form of collagen. And that whole process takes about 3 to 6 months. So unlike the laser treatments where you get the downtime and redness and peeling and you see a result as early as a week or 2 weeks, these are a little bit more delayed. And so you have to really make sure patients are aware of that it's going to take time to see that full benefit.
Yeah. I think it's hugely important that we emphasize that over and over again, because again, they're so used to sort of the immediate effect of, Botox, neurotoxins, filler has an immediate effect. People like instant gratification.
Right.
But we know delayed gratification is very good in a lot of scenarios, right? Not just in skin, but in life.
And there's also, what's nice is if a patient has downtime and they want to do more than one treatment at the same time to get it done, I do have a number of patients where I will do one of those laser treatments, or I'll even combine lasers. I'll do one for broken blood vessels, one for brown spots. I'll do a non-ablative fractional laser, and we can even do a tissue tightening treatment all at the same visit. So that way they just get the downtime done all at once. They'll see that more immediate improvement in the reds and browns and skin tone as early as a month. And then the improvements in fine lines, wrinkles, maybe acne scars from the laser treatment will take about 3 months. And then underneath the surface of the skin, they've got sort of that tissue tightening treatment doing its thing. So over the course of 3 to 6 months, it's going to be a little bit tighter and lifted. So it's really nice that we can combine lasers and these different tissue tightening treatments and devices all in one setting for the patient who only wants to come once.
Brian, this has been super amazing, really insightful. I love your approach, individualized, very, very nuanced, very approachable, natural, and also for long-term gain and prejuvenation. So I hope to have you on again because we have so much more to talk about. We could keep going for a long time, but thank you so much for being here.
Yeah, thank you for having me. Be excited to come back anytime.
Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi DermMD.